Hi everyone, welcome back to Nobel Pets. I just wanted to take a moment to say a huge thank you to each and every one of you for supporting the channel. Whether you're a longtime subscriber or just discovering us, your views, likes, comments, and shares mean the world to us. Because of your love for our furry, feathery, and scaly friends, we've been able to grow this amazing community of animal lovers. It's all about sharing the joy, love, and happiness that pets bring into our lives, and I couldn't do this without you. Thank you so much for being a part of the Nobel Pets family.
Let's start our new video on Nobel Pets Dog breed of French Bulldog. The French Bulldog is one of the most popular dog breeds globally, known for its distinctive bat ears, compact size, and affectionate nature. This breed has a rich history that intertwines with human migration, industrialization, and societal changes. Below, we will explore every aspect of the French Bulldog, from its origins and history to training, health care, and more. Origin and history of the French Bulldog. Breed origins. The French Bulldog's origins trace back to England, where its ancestors were small bulldog breeds popular among lace makers in Nottingham during the early 19th century. These smaller bulldogs were bred for companionship rather than bull baiting, as their larger counterparts were. Migration to France. With the rise of the Industrial Revolution in the mid-1800s, many English lace workers, along with their small bulldogs, migrated to France in search of better opportunities. The breed began to develop its own identity in France, where it was crossed with other small breeds, including terriers and pugs. The distinct look of the French Bulldog started to emerge, particularly with the development of their iconic bat ears. Why named French Bulldog? The name, French Bulldog, is somewhat misleading, as the breed originally came from England. However, as the dog's popularity grew in France, the breed became associated with French culture, particularly in Parisian society. The breed's fame in France led to the French Bulldog name, and it was embraced by artists, writers, and fashion designers in France and later throughout the world. Breed orientation, popularity over the years. Development as a companion dog. The French Bulldog has always been bred as a companion animal. Unlike many other breeds, they were not used for hunting, herding, or guarding but rather for being affectionate and loyal pets. When was the breed first found? The modern French Bulldog began to gain significant popularity in the late 19th century, particularly in France and the United States. The breed was officially recognized by the American Kennel Club, AKC, in 1898. Migration and distribution of French Bulldogs. Spread to the United States. French Bulldogs were introduced to the United States in the late 19th century, where they quickly became popular among the American elite. The breed's popularity skyrocketed, and it became a symbol of wealth and status, especially after notable personalities started owning them. Modern-day distribution. Today, French Bulldogs are beloved worldwide, particularly in urban environments where their small size and affectionate nature make them ideal pets for apartment living. French Bulldog's nature and temperament. Personality traits. Affectionate and playful. French Bulldogs are known for their loving and playful demeanor. They form strong bonds with their owners and are particularly good with children. Adaptability. These dogs are highly adaptable, thriving in both apartments and larger homes. However, they prefer to be indoors due to their brachycephalic, short-nosed structure, which makes them sensitive to extreme temperatures. Low energy levels. While they enjoy short bursts of play, French Bulldogs are not high-energy dogs and are often content lounging around. Growth and development phases. Puppyhood. French Bulldog puppies are born small, generally weighing between 10 to 14 ounces. They grow quickly in the first few months, and by 8 weeks, they are ready to go to their new homes. Growth milestones. 3 to 6 months. Rapid growth, where puppies start to gain muscle mass and bone density. 6 to 12 months. Slower growth as they reach near adult size but continue to fill out. Adult size and weight. Male French Bulldogs typically weigh between 20 to 28 pounds and stand 11 to 12 inches at the shoulder. Female French Bulldogs slightly smaller, usually weighing between 16 to 24 pounds. Mating, pregnancy, and reproduction. Mating and conception. French Bulldogs often require assistance with mating due to their body structure, which makes natural mating challenging. Many French Bulldogs are bred through artificial insemination. Pregnancy duration. The gestation period for a French Bulldog is typically 63 days, though this can vary by a few days. Delivery, C-sections. Due to their broad heads and narrow hips, French Bulldogs often cannot give birth naturally. The majority of French Bulldog litters are delivered via C-section, which ensures the safety of both the mother and the puppies. Puppies per delivery. A typical French Bulldog litter consists of 2 to 4 puppies, though larger litters are rare. Reproduction and heat cycle. French Bulldogs go into heat approximately twice a year, and this is the ideal time for breeding if the owner intends to breed their dog. It is important to consult with a veterinarian before deciding to breed a French Bulldog, as their reproductive process often requires medical supervision. Step-by-step training schedule. Puppy socialization, 8–16 weeks. The most important phase of a French Bulldog's development is early socialization. Introduce the puppy to various environments, sounds, people, and other animals to reduce the risk of developing anxiety or aggression. Basic commands. 4 to 6 months. Begin training with simple commands such as sit, stay, come, and leave it. French Bulldogs respond best to positive reinforcement methods like treats and praise. Leash training. Leash training should begin early. French Bulldogs, like all breeds, need to be walked on a leash for safety. Use a comfortable harness rather than a collar, as their brachycephalic structure makes them prone to respiratory issues. Obedience training. Formal obedience training classes can be helpful for French Bulldogs, who can sometimes be stubborn. Consistency and patience are key, as these dogs may have short attention spans. Advanced training. French Bulldogs are intelligent but can be a bit independent. More advanced training, like agility, may not be as suitable for them due to their body type, but they can learn commands such as roll over or high five with time and dedication. Health problems, care, and medical needs. Common health issues. French Bulldogs, due to their body structure, are prone to several health problems. Brachycephalic airway syndrome, breathing difficulties due to their short noses. Symptoms: snoring, difficulty breathing, and heat intolerance. Care: keep the dog in a cool environment, avoid over-exercising, and monitor for signs of respiratory distress. Cure: in severe cases, surgery may be required to open the airway. Hip dysplasia, a genetic condition affecting the hip joints. Symptoms: limping, stiffness, and difficulty moving. Care: weight management and regular exercise can help reduce symptoms. Cure: in severe cases, surgery may be required. Skin allergies. French Bulldogs can be prone to allergies and skin infections. Symptoms: itchy, red skin, or rashes. Care: use hypoallergenic shampoos and consult a vet for appropriate medication. Cure: antihistamines or medicated ointments can provide relief. Intervertebral disc disease (IVDD), a spinal disorder common in French Bulldogs. Symptoms: sudden pain, paralysis, or inability to walk. Care: prompt veterinary care is required, and surgery may be needed in severe cases. Medication and hospitalization. French Bulldogs may need various medications throughout their life, including pain relievers, anti-inflammatory drugs, or antibiotics for infections. In severe cases like IVDD or brachycephalic airway syndrome, hospitalization and surgery may be required. Vaccination needs and costs. Core vaccines: rabies, distemper, parvovirus, and hepatitis. Non-core vaccines: Bordetella for kennel cough, especially if your dog interacts with other dogs. Cost of vaccinations. Puppy vaccinations typically cost between $75–$100 for the initial series, with booster shots costing around $50–$100 per year. Insurance, costs, and maintenance. Pet insurance. Given the French Bulldog's susceptibility to health issues, pet insurance is highly recommended. Plans typically range from $30–$80 per month, depending on the level of coverage and the dog's age. Routine costs. Food. High-quality dog food suited to small breeds will cost about $30–$50 per month. Vet visits. Routine checkups, including vaccinations, can cost around $200–$400 annually. Grooming. French Bulldogs require minimal grooming, but regular nail trimming and ear cleaning are essential. Professional grooming costs around $40–$60 per session. Lifespan and final thoughts. The average lifespan of a French Bulldog is 10 to 12 years. With proper care, including regular veterinary checkups, a healthy diet, and exercise, many French Bulldogs can live long, happy lives. Owners should always be mindful of the breed's specific
French Bulldog Health Problems, Step-by-Step Guide. French Bulldogs, like many other breeds, are susceptible to specific health problems due to their unique body structure, particularly their brachycephalic, short-nosed face. Below is a detailed breakdown of the common health problems, symptoms, diagnosis, care, cure, medications, hospitalization needs, pet insurance, vaccinations, and what every pet owner should know. Common health problems in French Bulldogs. Brachycephalic airway syndrome (BAS). Cause: due to the flat face and narrow nostrils, French Bulldogs often have difficulty breathing. Symptoms: noisy or labored breathing, snoring and wheezing, overheating easily, difficulty exercising, collapsing in hot weather. Diagnosis: veterinarians will conduct a physical examination and may perform imaging tests like X-rays or endoscopy to evaluate the airways. Care or cure: mild cases, keep your dog in cool environments and avoid overexertion. Severe cases, surgery may be required to enlarge the nostrils and airways. Medication: anti-inflammatory drugs or bronchodilators may be prescribed to ease breathing. Weight management and dietary control can alleviate symptoms. Hospitalization: hospitalization is required for surgery, with post-operative care involving oxygen therapy and close monitoring. Hip dysplasia. Cause: a genetic condition where the hip joint doesn't fit properly into the socket, leading to pain and mobility issues. Symptoms: limping or difficulty moving, pain when getting up or lying down, stiffness after exercise. Diagnosis: X-rays are used to diagnose hip dysplasia. Care or cure: mild cases, weight management, joint supplements, and controlled exercise. Severe cases, surgery may be required, including total hip replacement. Medication: non-steroidal anti-inflammatory drugs (NSAIDs) for pain relief. Supplements like glucosamine and chondroitin for joint support. Hospitalization: hospitalization may be required if surgery is needed. Intervertebral disc disease (IVDD). Cause: a spinal condition where the discs between the vertebrae slip or rupture, causing pain and potentially paralysis. Symptoms: sudden back or neck pain, loss of coordination, difficulty walking, paralysis in severe cases. Diagnosis: MRI or CT scans are often used to diagnose IVDD. Care or cure: mild cases, rest and anti-inflammatory medications. Severe cases, surgery to remove the damaged disc may be necessary. Medication: painkillers, steroids, and muscle relaxants. Physical therapy to aid recovery. Hospitalization: dogs with IVDD may require emergency surgery and hospitalization for post-operative care and rehabilitation. Skin allergies, atopic dermatitis. Cause: allergic reactions to environmental factors, pollen, dust, etc., food, or parasites. Symptoms: itchy, red skin, frequent scratching or licking, hair loss in affected areas, recurrent ear infections. Diagnosis: skin tests, allergy testing, or food trials to identify the allergen. Care or cure: identify and avoid the allergen. Medicated shampoos and topical treatments to soothe the skin. Medication: antihistamines or corticosteroids for relief. Antibiotics for secondary infections caused by scratching. Hospitalization: not typically required, unless there is a severe infection. Ear infections. Cause: French Bulldogs have narrow ear canals, making them prone to infections. Symptoms: head shaking or scratching at the ears. Discharge or foul smell from the ears. Redness or swelling inside the ear. Diagnosis: physical examination and ear swabs for laboratory analysis. Care or cure: regular ear cleaning with wet recommended solutions. Keep ears dry and clean to prevent infection. Medication: antibiotics are antifungal ear drops, oral medications for severe infections. Hospitalization: not usually necessary unless the infection has spread or surgery is required. Medication needs:
NSAIDs non-steroidal anti-inflammatory drugs for pain and inflammation, commonly prescribed for joint issues. Steroids, for severe inflammation, often used for conditions like IVDD or allergies. Antibiotics, for bacterial infections, especially skin infections or ear infections. Antihistamines, to relieve allergy symptoms, whether environmental or food-based. Supplements, glucosamine and chondroitin are often used to support joint health, particularly in older French Bulldogs. Eye drops, for conditions like conjunctivitis or dry eyes, which are common in brachycephalic breeds. Hospitalization requirements. French Bulldogs might require hospitalization for certain health problems. Surgical procedures, for BUS, IVDD, or hip dysplasia. Post-operative care, after major surgeries like a C-section. If pregnant, they may need extended monitoring. Oxygen therapy, in cases of severe respiratory distress, oxygen support may be required after surgery or during heat stress. Pet insurance for French Bulldogs. Given the breed's predisposition to certain health problems, pet insurance is highly recommended. Insurance can help cover routine care, vaccinations, wellness exams, and dental cleanings. Accident and illness, coverage for surgeries, diagnostic tests, X-rays, MRIs, and medication. Cost of insurance, plans typically range between $30 to $80 depending on the coverage and the dog's age. Vaccination needs and costs. Core vaccines. 1. Rabies. 2. Distemper. 3. Parvovirus. 4. Adenovirus hepatitis. Non-core vaccines. 1. Bordetella kennel cough, important if your dog will be boarded around other dogs. 2. Leptospirosis. 3. Canine influenza. Cost of vaccinations. The initial puppy vaccine series typically costs between $75- or Annual boosters cost about $50- or depending on the vet and location. What French Bulldog owners should know. Regular health checks. Routine vet visits are crucial for early detection of health problems. French Bulldogs should have an annual exam to check their weight, breathing, and overall condition. Breathing precautions. French Bulldogs should not be exercised in extreme heat due to their brachycephalic nature. Avoid over-exercising them, especially in warm weather, as they are prone to overheating. Diet and weight management. French Bulldogs are prone to obesity, which can exacerbate joint issues and breathing problems. Keep them on a healthy diet, with measured portions and limited treats. Regular grooming. Their short coats are easy to groom, but they need regular cleaning of facial folds as trapped moisture can lead to infections. Regular ear cleaning is also essential to prevent infections. Dental care. Dental hygiene is important for French Bulldogs to avoid gum disease. Brush their teeth regularly or provide dental chews recommended by your vet. Exercise needs. While French Bulldogs are relatively low energy, they do require daily walks and some playtime to keep fit and mentally stimulated. Aim for 20-30 minutes of moderate exercise each day. Costs and maintenance. Routine costs. Food, $30- depending on the quality of food. Vet visits, routine visits, including vaccinations, cost about $200- annually. Grooming, minimal, with professional grooming costing around $40- if needed. Special considerations. Surgical costs, C-sections, bus surgery, or hip replacements can cost several $1,000s. Medications, depending on the condition, medications can range from $20 to $100, especially for chronic conditions like allergies or joint issues. Life expectancy. The average life expectancy of a French Bulldog is between 10-12 years. With proper care, many French Bulldogs live long, healthy lives, though they may require extra attention due to their predisposition to certain health issues. Regular veterinary care, a healthy diet, and a supportive environment will maximize their lifespan. In summary, French Bulldogs are a wonderful breed that requires special attention, especially when it comes to their health. Owners should be prepared for potential respiratory and joint problems, but with proper care, medication, and vet visits, these dogs can live a happy and fulfilling life.
If you enjoyed it, don't forget to give us a thumbs up, and subscribe if you haven't already to stay updated with all our future content. Also, hit the notification bell so you don't miss out on any of our adorable pet videos. As always, we love hearing from you, so drop a comment below and let us know what kind of pet videos you'd like to see next. Until next time, keep showing love to your pets, stay safe, and we'll see you in the next video. Bye for now.